Caitlin for Dr. Spear. Hello.
Hi.
All right, we're gonna head right back this way. We're gonna get your weight real quick here.
Okay.
If you want to put yourself down and take your shoes off, feel free. Otherwise, just perfect. All right. We'll head back to the room now. All right, Caitlin, can you tell me your name and date of birth?
Yeah, Caitlin Colzo, 9/18/95.
Thank you. So I see that you are allergic to morphine.
Yes.
Okay. We don't have documented like your reaction. What happens when you take that?
I just get some face swelling.
Okay.
Yeah.
All right. So today you are here for your preventative visit. Is there anything else going on that you want to talk to Dr. Spear about?
Yeah, I actually do have some bumps on my arm up here.
Okay.
So if you look at that.
Yeah. Have you tried anything for them?
Yeah, I've been using Benadryl cream, but I haven't really noticed any results.
Okay. Sounds good. Can't tell that you've gotten your flu vaccine this year. Have you gotten that?
No, not yet.
Okay. Is that something you'd like to do today?
Yeah.
Okay, perfect. And then the other vaccine that you're due for is an HPV. Are you interested in getting that?
I'm not really sure what that is.
Okay, so this is just a vaccine that helps with cervical cancer and prevents cervical cancer. It's not something that I can order as in my current role, but I'll have Dr. Spear talk with you a little bit more about that.
Okay. Yeah, that'd be great.
Okay. I will go ahead and give you the 2 vaccine information sheets for you to just look over, as well as the flu consent. So as I'm kind of asking you some questions, you can start to review that stuff.
Okay.
Here's that.
Thank you.
All right, so you are not at the point where we need to worry about colonoscopies or mammograms quite yet.
What age do I need to start worrying about that?
All of that usually starts around 50.
Okay, even though my mom has breast cancer now, should I maybe start sooner?
Sure. I'm not going to be the one to answer that question, but I will let Dr. Spear know that that's something you guys want to you guys need to talk about. The other thing is, since you have a type 2 diagnosis or type 2 diabetes diagnosis, I'm going to go ahead and get your A1C because I don't see one on record for the past 6 months.
Okay.
Over the past 2 weeks, have you experienced any loss of interest or pleasure in doing normal things?
No.
Okay, what about feeling down, depressed, or helpless?
Nope.
Do you smoke at all?
Yes, I do.
Okay, how much?
About a pack a day.
Okay, are you interested in quitting?
Yeah, I'd love to.
That is fantastic news. So what I can do, as long as you're okay with it, is I can give your information over to the Indiana Quit line,
Okay.
and they'll contact you and try to help, kind of set up a quit plan.
Yeah, sounds good.
All right. Do you drink any alcohol?
Just socially.
Okay. What about illegal drugs?
No.
Okay. This is not your first time seeing Dr. Spear. It looks like we saw you about 10 months ago. And from what I can tell from our documentation, it doesn't look like you've been admitted to the hospital since your last visit.
No, I haven't.
Okay. Perfect. We are going to just go ahead and review your medications. It looks like you're currently on lisinopril.
Yes.
Are you still taking that as prescribed?
Yes.
Okay. What about the metformin?
Yes.
And then Ambien?
No, not anymore.
Okay. Is there a reason you stopped it?
I've just been sleeping better, so I don't need it anymore.
Wonderful. And then lastly, are you still testing your blood sugar twice a day?
Mm-hmm. Yep.
Okay. What I can do with those medications is it looks like you're about due for some test strips, so I will go ahead and send that over to the pharmacy now.
Okay.
It looks like you are also due for refills on the other 3. I will get those ready for Dr. Spear to sign when he comes in.
Okay, thank you.
Do you still use the Kroger pharmacy?
Yep.
Wonderful. All right, I'm gonna go ahead and get your vitals. I'm gonna take this from you, and can you uncross your legs and put your feet flat on the ground? You haven't been running any recent fevers or other than that feeling okay?
No.
Okay, yep, perfect. When's the last time you went to the bathroom?
Probably a couple hours ago.
Okay. That can sometimes flush your blood pressure. That's the only reason I asked.
Okay.
All right, so overall, your vitals looked really good. Your blood pressure was 134/80. Your heart rate is 95, and your oxygen is 99. Did you have any questions about those vaccine information sheet that I gave you
Nope,
around the
I
flu?
didn't.
Okay, and I see that you signed the consent, so I am going to go ahead and run and get the flu vaccine as well as the stuff to do your A1C.
Okay. Yeah.
All right, I documented your flu vaccine, and I have your A1C running. So as soon as it takes them a couple minutes. So as soon as the results are in, I'll bring them into Dr. Spear when he's talking with you.
Okay.
And then, like I said, I already sent over your test strips to the pharmacy. Dr. Spear will sign off on your other refills when he's in with you. And do you need a copy of your vaccine records or a work note or anything?
Yeah, that'd be great.
Okay, perfect. And then I will also make sure I update Dr. Spear about your rash on your arm and just wanting to talk with him a little bit more about the HPV vaccine as well as your mom's history. Thank you so much. He'll be in shortly.
Thanks.
Hey, Dr. Spear. Caitlin is ready in room 3. She's just here for her preventative. Has a rash on her right arm that she just wanted you to look at. She tried some Benadryl cream that hasn't really worked. I gave her her flu shot. I drew or ran an A1C that's still running. And she just has questions about her HPV vaccine as well as like when the mammogram screenings start due with family history.
Perfect.
I'm also going to print off a work note for her as well as her vaccine records.
Okay. And then when the A1C is done, just bring me the results.
Perfect.
All right. Sounds good. Thanks.
Thanks.